Welcome DEKWP, 小工 Abor. Your learning journey starts now. Ever seen an AI doctor overreact? Meet DeepSeek. It looked at a guy with a week-long cough, some night sweats, and immediately thought, tuberculosis. Seriously? That's like seeing a shadow and calling it a werewolf. We're diving into why this AI model's medical advice is a bit of a hot mess. So, DeepSeek not only misdiagnosed but also prescribed like a mad scientist. First up, antibiotics. For a simple, likely viral, acute bronchitis, no. Guidelines are clear. Hold off, unless there's pneumonia. Yet, DeepSeek might suggest more stronger ones, ignoring the patient was already improving on cefaclor. Then, the hormone suggestion. Corticosteroids for a cough. That's like using a sledgehammer to crack a nut. Absolutely no evidence supports them for this condition, just potential side effects like high blood sugar and weakened immunity. Remember, the goal is recovery, not unnecessary chemical warfare. Now, let's talk labels. DeepSeek might slap a chronic disease tag on this poor fellow. Chronic bronchitis, COPD, cough variant asthma. Hold your horses. Chronic means years, not weeks. This guy had symptoms for a week, no prior history. Night coughs can happen, sure, but linking it directly to chronic conditions or even tuberculosis without classic signs like fever, weight loss, or months of symptoms, that's diagnostic whack-a-mole. The reality is much simpler. Post-infectious cough. It happens after infections, it's usually self-limiting, and it goes away. Don't let AI scare you into thinking you have a lifelong sentence. And here's where it gets really expensive and potentially harmful. Over-medicalization. Imagine DeepSeek saying, let's rule out everything. Get a chest X-ray, a CT scan, a TB test, maybe a laryngoscopy. Why? Because the patient's coughing for a week. Guidelines explicitly say no routine imaging for uncomplicated acute bronchitis unless there are red flags like hemoptysis or severe dyspnea. These tests expose patients to radiation, cost money, and often lead to nothing. Same goes for escalating treatment too fast. IV antibiotics, specialist referrals, unnecessary. The smart path is observation and follow-up, not jumping through hoops. So, what's the big picture? DeepSeek, while fancy, sometimes overcomplicates the obvious. It risks causing undue anxiety, exposing patients to unnecessary drugs and tests, and potentially delaying proper care. The key takeaway: when faced with common ailments like this, trust the established clinical guidelines. Observe, monitor, and consult a real doctor if things don't improve or worsen. Don't let an algorithm turn a minor hiccup into a perceived catastrophe. Stay sharp, stay informed, and keep those guidelines close.